My name is Bianca. I'm going to be the nurse practitioner student doing your head to toe assessment today. How are you?
I'm good. How are you?
Okay, I'm going to do hand hygiene. Very good. Alrighty. Can I have your first name, please?
It's Gracia.
Okay, Garcia. And can you tell me where we are today?
We're in the clinic today
Okay, and why are we here?
to do my annual physical assessment.
Okay, very good. And what's today's date?
Today is August 23rd, 2025.
Okay. And then just to identify you, what year were you born in?
In 1995.
Um, So Garcia appears to be healthy. She is alert and oriented times 4. To person, place, time, and situation. She is not ill looking. She looks healthy. Appears of age. Her posture is up and erect. Skin tone color is normal. She does not appear in any signs or symptoms of distress. Um, okay, Garcia. So to start, we're going to start with your head and your face for your assessment. So we're going to look at your hair. So with your hair, we can tell that there are no lesions. Your hair is well distributed. I also did not see any bald patches. No alopecia noted. No dandruff. And we're gonna go ahead and look at your face as well. Face looks symmetric. Nothing seems out of the ordinary. No lesions. Skin looks fine. Skin looks great. No rashes noted either. Now we're gonna go ahead and palpate. Okay. So on your scalp, is there any tenderness?
No.
Okay, we're also going to check here on your temporal arteries. Any tenderness there?
No.
Okay, so on your scalp, I did not feel any masses or lesions again, and nothing else abnormal was noted. Okay. On your face, we're going to go ahead and start by just assessing parts of it, which is your mouth, your nose, your eyes, and your ears. Okay. So first off, we're going to do um, your your mouth. So we're gonna look inside. So already you can already see the lips appear pink and intact. The inside also looks moist, pink, and intact. No lesions noted. We're looking at the Wharton ducts and the other ducts on the salivary glands. And we're looking inside. Tongue appears pink and moist. Teeth look great. Gums look intact as well. And we're gonna have you stick out your tongue. Say ah. Very good. So this is checking cranial nerve number 9, and we're checking your tongue movement as well. So let's have you move side to side, and then up and down. You can also use a tongue blade to check movement with resistance. We're also checking the inside, the posterior pharynx. You can see that the tonsils are even and non-distended, not swollen. We're also going to check your jaw. So with your jaw, I'm going to have you open up, side to side. Okay, and then you're going to bring your jaw out and bring it back in. And we're checking for crepitus. There's no crepitus, and with that movement, you can see that cranial nerve 5 is intact. So now we're going to look at your nose. We're going to look and see that the skin is also normal. We're going to look inside. No lesions noted. Your nares appear patent. Your septum is midline, not deviated. And I'm going to go ahead and palpate your nose. Any tenderness there? Okay, very good. We're also going to check your sinuses. So we check here. We're going to palpate your eyebrows. And we're going to palpate your frontal sinus, the ethmoid sinus, and your maxillary sinuses. Okay. We're also going to check your your breathing. Okay. So I'm going to hold this here, breathe, good, and this one here, very good. So they are patent, and we're also going to check if you can smell something for me. Okay. And I'm going to have you close your eyes, and then I'm going to bring it in front of you. What did you smell?
And rubbing alcohol.
Very good. Can you also feel the sensation on your cheeks?
Yes.
Very good. So we're going to check your ears now. So we're going to check the inside of the ear. So we'll hold your auricle up and pin it back. We're going to check inside. Check the inside of the ear canal. It looks patent, no obstruction noted. The skin on the ear is equal, good color, and it's intact. No lesions, no rashes on the front or posterior ear. And here again, we're going to bring the auricle up and back. Check the canal. No obstruction, looks clear. Skin also appears to be clear, no lesions, no rashes anteriorly or posteriorly. We're now going to check your hearing. So I'm going to whisper 2 words. And when I say those two, after I say those 2 words, you can repeat what I said. Okay? So I'm going to have you cover your left ear.
Green apple.
And then we're going to do the other one.
Red apple.
Okay, very good. So that was correct. So cranial nerve 8 is intact. And now we're going to check your eyes, okay? So we're going to have you read some numbers for me. So we're going to use the Snellen chart.
Okay.
You're going to read the smallest that you can. If you can, read the very bottom one. There are 4 numbers there.
Okay.
Go ahead and cover your left eye.
Okay. 1, 3, 5, 7.
And then we'll do the other eye.
Okay. 1, 3, 5, 7.
And then both eyes together.
1, 3, 5, 7.
Very good. So your eyes, your vision is 20/20, according to the Snellen chart, okay? And now we're going to go ahead and check your EOM. So this checks for cranial nerves 3, 4, and 6. So we're going to have you just follow this. You're going to use this pen light for you to follow up, down, side to side, up, down, and then back in the middle. We're going to have you do this. Good. And we're going to shine a bright light in both pupils. Here's 1, 2. Good. So eyes appear equal round reactive to light and accommodation. We're going to check corneal reflex as well. That's intact. Also the pupil size, you're about a 5 millimeter right now without the light, and with the light it turned into 4. Now we're going to move on to your neck. And so we're going to look at your neck and we're going to look midline, that there are no any masses here. So I don't see any masses. Your trachea appears midline, no deviation noted. And I forgot if I said your septum also is midline, no deviation. And also we're going to look at the skin. It looks clear, no rashes, no lesions posteriorly or in the front. Now we're going to palpate. No lumps noted, so no issues that I would think would be on your thyroid. Very good. And then I'm going to go ahead and check your shoulders. So I'm going to have you move up against my hand, and then let's have you rotate your shoulders. Good. So range of motion is there, and cranial nerve 11 is intact. I'm also going to check your swallowing. So I'm going to have you swallow. So cranial nerve 10 is intact as well. So now we're going to check your thorax. So I'm going to also listen to the lungs at this during this system check, okay? So we're seeing right now that you are breathing equally and symmetrically. You're not having any trouble breathing, not using ICS or accessory muscles. And your AP diameter, you do not appear barrel chested. You do appear to have a normal AP to transverse 1 to 2 diameter. We're going to go ahead and check the back. So I'm going to have you just rotate slightly, very little. There we go. And we're going to check your coastal angle, appears to be 90 degrees. We're also going to percuss your lungs, okay? So we're looking for resonance. Okay. So on percussion, resonance sounds are normal. That's completely normal. We're also checking your vertebrae. We're palpating downward. Any paraspinal sensitivity for you?
No.
No tenderness?
No.
And we're also doing the CVA tenderness check. Good. Any tenderness there? Anything on my head? So kidneys also are being checked there, okay? So now we're going to listen to your lung sounds. We're going to listen to posterior first. And I'm going to go ahead and use my stethoscope. We'll use the diaphragm here. So we're going to be listening to your apices and laterally, your paraspinous, which is towards the middle of the spine, going a little lower, and then taking deep breaths. Thank you. And then every time I move, you take a deep breath. Okay, so let's do apices again. Good. Paraspinous. Good job. More paraspinous. We're gonna do subscapular, which is underneath the scapula. And then we're going to do lateral, deep breath, and deep breath. And we're going to do the right, mid, low. Very good. And we're also going to listen to the front side of the lungs. So we're going to listen here. We're going to hear some bronchovesicular sounds on the intraclavicular sides, okay? So let's have you have a deep breath. And we're also going to listen to the mid-anterior chest, okay? So let's do one here. And then these are vesicular sounds. We're also going to do the trachea. Good, and those are tracheal sounds, okay? Very good. Lungs are clear. no abnormal lung sounds found. We're also going to check your lymph nodes. Sorry, going back to your neck assessment. So we're going to check all lymph nodes, okay? So we're going to check your occipital, your tonsillary, your submandibular, your submental. We're going to check your supraclavicular. We're going to check your posterior cervical, and we're also going to check your superficial cervical in the front of the neck, okay? So everything feels great, no tenderness when I palpated. Very good. So now we are going to listen to the heart. We're going to have you lay back just very slightly. And then now that you're laying down, I'm going to go ahead and listen to your heart. But first I want to point out, I want to point out the locations as I'm listening, okay? So we're going to listen first with the diaphragm. And actually, we're going to first look at your skin. So normally you would be without the shirt, okay? But right now, for the purposes of this video, we'll keep your shirt on. So you're going to look at the skin, you're going to look at the neck again, you're going to look at your carotid arteries, your jugular vein, we're going to look for any distension. So I'm going to have you turn your neck that way, good, and now this way. Very good. So no distension of jugular vein. And we're going to go ahead and check your carotid pulses, one at a time. Good, those are +2. And we are going to feel the carotid artery for any thrills. No thrills noted. I'm going to go ahead and take a listen. We're going to listen to the carotid artery first with the diaphragm, with the bell. And we're looking for bruits. And no bruits noted right now. So now I'm going to listen to your heart, okay? So we're going to listen to your your aortic, and it's going to be on the second intercostal space to the left side of sternum. We're going to listen to your pulmonic, which is on the right. Sorry, this is the right side here, the aortic of the right side of the sternum, second intercostal space. Then on the left side, we have the pulmonic on the second intercostal space. We have Erb's point on the third intercostal space. And we have the mitral on the fourth intercostal space. Sorry, not mitral, the tricuspid on the fourth intercostal space. And then on the fifth intercostal midclavicular, we have the mitral. So on the mitral, that's also the API, and we will be helping later. We're also going to use the bell to listen to the same ones, okay? First point, tricuspid, mitral, and the aortic. Okay, so now we are also going to just take a look at the PMI. The PMI, I do not see any bounds, heaves, or lifts. I'm also going to palpate. Yep, feels great, no thrills. We're also going to now look at the abdomen, okay? So for the abdomen, we're going to look first, skin looks great, contour. We can see that the stomach is flat, no distension, and we will be um, listening to your bowel sounds first, okay? So we'll use the diaphragm for that. And we're going to listen to all 4 quadrants. Very good. I listened to bowel sounds in all 4, okay? Oh, very good job. And we're also going to listen to the aorta, okay? And I can hear +2 sounds there. There's no thrill noted there either, okay? So now we're going to go ahead and percuss your abdomen. So we are looking for normal tympani sounds, okay? So that all sounds normal and tympani, okay? And now we're going to go ahead and palpate there. So we're going to palpate lightly first. Okay, and then we're going to do a little bit of a deeper one, okay? And we're looking just for organomegaly or any lesions of sorts or masses. Everything feels very normal for you, okay? All right, so I'm going to have you sit back up, or we can start checking um, your musculoskeletal stuff and your peripheral vascular. Okay, so I can have you turn this so just to be more comfortable. Alrighty, dear. So now we're gonna have you just move your arms outward. So we'll do musculoskeletal first, and then you're gonna bring them up, down, and then behind your back. Okay, very good. And at the same time, I'm checking peripheral vascular, so we're checking pulses. We'll check your brachial pulses, your radial pulses, ulnar. Good. Your skin also appears clear, hair is well distributed, and then we'll do your cap refills. This side is less than 3 seconds, and then this one over here so far, also, okay? Less than 3 seconds, very good. And we're gonna show me your hands. You're gonna extend your hands, bring them back in, close them, move your wrists up and down, set around, very good. And as you're moving everything, I don't feel any crevices, okay? Um, we're also going to check your legs, and we're going to check range of motion and your pulses as well, okay? So I'm going to check your femoral pulses bilaterally, they are +2. We'll check your popliteal as well, those are +2. And we will check your tibial pulses and your pedal pulses. Bilaterally, they are all +2, okay? We'll start with your foot, we'll do range of motion, I'll have you move them up, both up, and then down. Good. Let's have you move your ankle in circles. Good. Range of motion, no preference noted. And we're going to have you bring your leg up against my hand. Against resistance. Very good. And down. Good. Same thing over here. And good. So good thing there. And then now we are going to check your range of motion of the hips if you'd like to lay back. And then here we're going to lift your leg up. We're going to bend your knee. And we're going to move for your hip motion and your knee motion, no preference noted, and your leg motion. Very good. We'll do your other one. Let's bend your knee, down, up, go through this. Very great range of motion, no preference noted on the knees, hips, or your leg. Very good, Gracia. So now we are going to do your neurological exam, and part of the neurological exam, I will be having you close your eyes, and I'm going to draw a number on your hand. You tell me what you feel, okay? 2, 3. Good. Very good. And now I'm going to have you tell me whether something is dull or sharp and what side, okay?
Sharp right, dull left.
Very good, very good. So sensation is intact, and the stereogenesis is also intact. Now we're going to have you do a quick little test and have you stand up. As you're standing, I'll finish off your musculoskeletal range of motion and we'll do your spine. So for your spine, I'm going to have you bend forward, backward, and side to side. Okay, so forward, backward, and then side to side. Very good. So now I'm going to have you just have you walk forward and do a gait assessment. Very good. And then I'm going to have you do the Romberg. So you're just going to stand there. We're going to look for Romberg sign, okay? So you're going to stand there. You're going to hug yourself a little bit and close your eyes. And we're looking for any swaying, making sure you're not sliding from side to side abnormally, and yet your balance is intact, okay? So very good. So Romberg sign is negative, and that's normal. Now we're going to do the tandem walk. So we're going to do your feet. You're going to walk one foot in front of the other. You're going to go forward a few steps and then backwards, okay? We're also looking for balance there. Very good job. Very good job. Okay, so now I'm going to have you sit down again. And I think that concludes our test. But for the most part, neurologically, Gracia was cooperative. She was calm. She demonstrated a positive thought process. Does not admit to having any thoughts, abnormal thoughts such as hurting herself or anything like that. So I will perform hand hygiene before I walk away. And Gracia, I appreciate your time. Thank you very much for today. And this concludes our assessment. Okay.
Okay.
Thank you.
Thank you for the